Good afternoon.
Now I understand why you brought your own laptop, because everybody's presentation is only stored in that, and I was wondering how come you brought yours. Now we understand.
One thing, I think the speaker before me, I have an, you can say, association with this name. I am in management fields, and I'm a psychiatrist by profession, but I'm in management field, and I'm more known in management field rather than my medical field. And I'm in institutional development, and most of, you can say, the friends who are like what the previous presenter was are Bala Subramaniams. And they are all Balas, we call them, and Balas are always like him. That's what I'll mention to change the attitude. I'll introduce myself. My name is Dr. S.S. Kulkarni. I am from Maharashtra. I am in Delhi since last 19 years now. And what I was involved in last 19 years in Delhi is developing educational institutions. I have developed educational institutions right from schools till medical, you can say the colleges, in nursing schools and paramedical institutions and universities, multiple kind of things. I have developed nearly 30 institutions in the whole of North India. 4 years back, I have started my company, and I am in developing educational institution with only one purpose. As a student, when I remember I was in Maharashtra, I think I have been the secretary of one of the organizations called Lokavidnyan Sangatana, People's Science Movement. And I remember those days when I used to lead a movement where we were working on a project which was called Where There Is No Doctor. And the another project that you reject the medicines. You don't need medicine for treatment. So these were the two movements which were, you can say, one of the basic things which I was working on. One very sad thing which I face in this country, which I'm continuously working on, is that we talk about the making availability of medical specialists and doctors, who are basically called doctors, supposed to be treating the patients. But we never talk about the support facilities and the assistants who are required to supervise the treatment afterwards. The most of the villages, and when we talk about the villages, this city, when I am in this city, in Delhi, since last 18, 19 years, I have my house in Sarita Vihar. 3 kilometers from Sarita Vihar, there is a village which has not even a primary care center, which is from this place where I'm speaking in Ashoka, if we talk about, it is just 28 kilometers from this place. In this city or in Mumbai, because I am from Maharashtra, everywhere when we talk about very well-developed DDA colonies or very well-developed urban societies, we have Laldora, you can say the facilities available at the back, where it's very thickly populated, you can say the area, where we don't have basic medical facilities available. You may have AIMS, which is just next 2 kilometers from a Laldora village, which is at the back of AIMS, where you will have at least 16, 17 RMPs, who call them RMPs, practice there, who don't even understand what is medical treatment. The basic thing which we need to do is that when we talk about numbers, we require 600,000 doctors today. We require 1 million of nurses. We require 200 or 300,000 dentists today. But we never talk about in statistics that we require the support facility people who understand what is actually the delivery of medical system. The whole educational system which I work on, which I insist on wherever I get the opportunity for, is I need doctors. I definitely need doctors. But in this urban civilization, most of the hospitals where I create the hospitals, my residents are not allopathic doctors. My residents are Ayurvedic doctors. My residents are homeopathic doctors who get trained for 6 months for the treatment as we are treated. Dr. Lele is here, very senior person, very senior people are here. The most sad part of it is that once we have passed out our degrees and the qualifications, whatever continuing education is done in this country is done by the pharmaceutical companies. Most of the people who actually practice in the hospitals and treat in even the urban hospitals are not the people who have been trained properly. They may be Ayurvedic doctors. They're not supposed to do allopathic practice. They don't understand even the basics of anatomy and physiology, Professor. What do you say? These pictures which I have seen, these animations and all are not even available to the most modern medical colleges. When we talk about the private medical colleges, it is only the doctors who are appointed, but the content is not available. Who's teaching there? The people who have lost the touch with the content, the people who have lost touch with what is the academics, the people who have lost touch with what is the research, they come and work in our medical colleges. The people who have been in administrative services, they work in medical colleges. They teach in medical colleges. We need to, when we talk about that, we require so many doctors, we require so many nurses, we require so many paramedics, we require so many, you can say, the people who at least understand what is health and hygiene. So it's a total solution this country should look at, that I have a huge population. We need support at every level. But how we create the total, complete solution of an educational system in medical education, when we talk about villages, we have urban villages where we have most modern hospitals available like Apollo, but at the back of Apollo, you have a village where there is no facility available there. And the people who stay in that village don't have an access because of their financial, you can say, the capacity. They cannot just enter Apollo hospital. There may be an excellent consultant available there. There may be 700 consultants available there who are experts, but their services are not available to those villages which are just at the back of it. And when you see Apollo, again I'll go to Delhi, Apollo, Holy Family, Escorts, all these leading hospitals are there. But in between there is, you can say, a locality which is Jamia Millia, and you don't get good medical facility there. Because most of the medical facilities are run by the people who don't understand what is medical treatment. And as a country, as a health policy of this country, if at all we have to do all these, you can say, the technologies which are beautifully developed, people are working on it. These whole systems can only be implemented in this country if we have a strong policy of the government and a will of the people to work. I go and I develop educational institutions, and I normally convince the doctors who are doing like what Babala is, that come and teach our people there to teach people. Medical students don't get the proper education in our private medical colleges, not even the government medical colleges. I have been visiting as an advisor to even the government medical colleges. You don't get the professors there because professors, they just register there. They go and sign there. But because of their, you can say, the children are studying in urban, this thing, there is someone who is signing on his behalf, and our professor is sitting in an urban, you can say, the city. Now this policy implementation is what most important thing, which I feel as a country, as a whole, when we have excellent content, we have excellent, you can say, the doctors available, we have excellent facilities available to train the manpower. We don't have a will to do that. And we don't influence, as educated people, doctors, like a doctor like me, who's a psychiatrist, who works in educational institution development only because I feel that this country requires committed, educated population to go back and give the committed treatment to this country's people and the population. If we can influence the government through the conferences like this, that create a complete solution in at least education first to train the manpower, and as a holistic solution, that if a doctor goes to a village, he should have a support facility available of at least a nurse who understands what he wants, at least a paramedic who can give a support, at least and support, you can say, the person who can supervise the treatment even if the doctor is not there afterwards. What happens to most of our hospitals, I think I work with Apollo hospitals, I work with the leading groups for development of the hospitals. Most of our hospitals, what happens? If we talk about the leading, most modern facilities in the urban population, all our consultants who are supposed to be tertiary care consultants, they land up into treating the primary and secondary care patients. Whereas those patients are not supposed to come to this costly facility. Because we don't have the confidence of the people into the primary and secondary care facilities which are available there, people don't want to work there. We can very easily say that why people are not willing to work in villages. The villages are not quite far off now. People are willing to work in the villages. But if a doctor goes to a, you can say, a village and there is no facility available there, he won't have a motivation to go back again. Because everybody and anybody, because the population is aware of what they want from you. There is a you can say, an awareness there now. And that awareness in last 10 years is going up very fast. So people are aware, they want some facilities to be available there. But in medical education, if we think of the total system of education to be created as a consolidated solution and create a policy for the whole nation with the growth of population which we have, I think we'll be in a position to do something which is extraordinary. I think this was a point of view which I wanted to just mention. Thank you very much for giving me a patient listening.